program that continues to explore alternative ideas and concepts that are encompassed in the New Age. These ideas you can use in your everyday life in the areas of health, our environment, and we also delve into the psychic or metaphysical area.
And I'm Elaine Charal. Yes, I am. I'm Elaine Charal. And we come to you live each week on Thursday evenings. We are rebroadcast Sunday evenings at 7. Each week we have an hour of informative guests. We do dream interpretation, handwriting analysis, and we usually close with a meditation.
And our first guest, Elaine, is Dr. Carolyn Dean. She is a medical doctor, and she's going to be talking about alternative health care methods that you can use to help yourself when you cannot reach a doctor.
Our second guest is Dr. Carolyn DeMarco. She has written a book, Take Charge of Your Body. And she's going to be terrific, as Carolyn Dean is. I know you're all going to want to talk to them both. We're going to take a short break right now. When we come back, Anne will be chatting with Dr. Carolyn Dean. Please stay with us.
And welcome back. With me is Dr. Carolyn Dean, an MD. Welcome to the show, Carolyn.
Thank you, Anne.
What type of medical practice do you have, and how long have you been practicing?
I've been in practice for 12 years, and my practice is a general family practice, but I've always had the direction of preventative medicine or nutritional medicine in my practice.
So then it wasn't a, a far jump to go from doing what you do to help people in the traditional way and then going into the alternative area. When did that happen?
Well, before I went into medicine, my grandmother was a homeopath, and homeopathy is a method of helping people with their health care that uses small infinitesimal doses of herbal mineral remedies that are given to a person to help assist their body heal itself. So it was probably in my genes that I learned this. And before I went into medicine, I was studying these natural methods. So I went into medicine to make sure that I had both sides of the story, and I could do both, because there's a lot you can use to help people before you get to drug medicines, which sometimes can have side effects.
Now, you've written a book, and the book is called Remedies When You Cannot Reach the Doctor. Mm-hmm. What caused you to make, or to make yourself go to the extent of writing this book?
Well, basically, my practice is very busy. I haven't been accepting new patients personally for many years. Other doctors in my clinic are accepting patients. So what was happening is I found myself repeating advice to people over and over again. So I thought, well, if I can write it down, and actually this was supposed to be handouts for patients. Colds and flus, okay, here's a handout. Premenstrual syndrome, okay, here's a handout. But it turned out to be a book, which is doing quite well. I'm told it's a bestseller, because in Canada you have a bestseller if you sell over 2,000 books, and I think I've sold about 3,500. And basically it's to help people at home while they're either waiting for a doctor's appointment or with simple remedies. And I've really cut down the office visits for patients coming for minor complaints, and I've probably helped the budget, the healthcare budget, by cutting back on office visits to OHIP. But anyway, it's a great book because it does put in a person's hands simple remedies that they can do themselves.
In essence, you're talking about taking responsibility for your own. I just want to show our viewers the book, and hope I don't drive you crazy with the flashing of the light. But it's very interesting in that I went through it, and you could almost pick up all different types of remedies that you can use, mm-hmm. and they're quite simple if you know what you're doing, if you mm-hmm. know where to look for them. How have you found, not only, I guess, maybe helping OHIP or whatever you were, I don't know how well that's doing, but how have you found the person reacting to it, their emotional response to it? Do you find that they're they've changed in their attitude.
Yes, very much so, because people will come in then just for their annual visit and say, oh, by the way, I've used your book a number of times to help myself or my family or friends, and anytime something goes wrong, I look up what to do. There's 100 different conditions that you can reference in it. And people, I think people seem much more confident about the fact that they can do something for themselves. Now, this is not to take away from doctors helping people with diseases. What we're talking about is people who have minor ailments. It's to prevent things from going too far, in a sense. It's to help people understand to take care of themselves before they get really ill.
You also have studied, and I don't know whether it's your passion or not, but you really go into great detail on Candida.
Right.
There's so much that people talk about it. What really is it?
Okay, in a nutshell, we all have this organism called Candida albicans growing in our intestines. And it can be primed, and it can overgrow with the use of too much sugar in the diet, the use of antibiotics. Antibiotics kill off the good and bad bacteria. So when the bad bacteria are killed off, yeast can overgrow. And other drugs can do the same. Now, we need medications at some times, but for example, when you take antibiotics, you should eat yogurt or take acidophilus to help give you back the good bacteria. Because if the yeast overgrows, people then start off with gas and bloating and all kinds of intestinal complaints. And then the 79 different byproducts that the yeast produce, they can then go into the bloodstream. We're not talking about yeast in the bloodstream, but these byproducts. And those can cause all kinds of almost allergic reactions through the body. Anything from headaches to poor vision to dandruff to acne to sore throats to gastritis, in women vaginitis, bowel disturbances, muscle aches and pains. Now, it sounds like a litany of every symptom you can find, but what I guess I could say, proven in my practice, and this study you were holding up is of 2,000 cases that I've studied by doing a blood test to check for the yeast antibodies, putting people on a diet and a program, and finding out that 80% of people with these head-to-toe complaints get better. Now, for me, this proves the fact that there is Candida. However, this particular study I sent off to a medical journal, and they said they wouldn't publish it at this stage because it's too controversial.
Well, that's what I was going to say. A lot of the medical profession, I don't know whether they want to say that it is this, or that this particular Candida leads to all the rest of the ailments and symptoms you've just named.